Syrup, Complete Guide. 1. Introduction. Malaria remains one of the most significant infectious diseases worldwide, causing hundreds of millions of illnesses and hundreds of thousands of deaths each year. It is a disease transmitted by the bite of infected Anopheles mosquitoes carrying Plasmodium parasite. Among the 5 species that infect humans, Plasmodium is the most dangerous, responsible for the majority of severe malaria cases and deaths. The fight against malaria relies heavily on preventive measures, such as mosquito control and bed nets, as well as prompt, effective treatment with medications. When such medication is syrup, produced by a pharmaceutical manufacturer in Pakistan, is an oral suspension containing 2 active ingredients, and permethamine, a combination that has been used for decades to treat and sometimes prevent malaria. Syrup is specially formulated for use in children and adults who may have difficulty swallowing tablet. Its combination therapy works by targeting the parasite's folate metabolism, effectively killing it and preventing further growth in the bloodstream. Though composition formulation. Syrup contains a sulfonamide antibiotic, permethamine, and drug. Both are combined in a suspension designed for oral administration. The standard packaging is a 15 ml glass bottle with a measuring device to ensure accurate dosing. Pharmacological classification. Sulfonamide antimicrobial. Permethamine, folic acid antagonist. This combination is sometimes abbreviated as SDX/PYR in medical literature. 3. Mechanism of action. The effectiveness of syrup lies in its dual blockade of folate synthesis within Plasmodium parasite. Inhibit synthase, an enzyme needed for the production of acid, a folate precursor. Without folate, the parasite cannot synthesize DNA, which is essential for cell division and replication. Permethamine inhibits reductase, another key enzyme in the folate pathway. This prevents the conversion of 2, further crippling the parasite's DNA synthesis. When used together, the 2 drugs act synergistically, meaning their combined effect is greater than the sum of their individual actions. This makes it much harder for the parasite to survive or develop resistance. 4. Indications. Therapeutic uses. Syrup is indicated for 1. Treatment of acute and complicated malaria, especially against Plasmodium, including some strains. Though intermittent preventive treatment in certain countries is used for preventive treatment in pregnant women and infants in areas. However, this is only done under strict medical supervision. In combination therapy. 7. Side effects. Like all medicines, syrup can cause side effects. Common side effects: mild nausea, vomiting, diarrhea, abdominal discomfort, mild rash. Less common: headache, fever, itching. Serious, rare but dangerous. Severe skin reactions: Stevens-Johnson syndrome, toxic epidermal acrolysis, blood disorders, megaloblastic anemia, leukopenia, thrombocytopenia, liver problems, hepatitis, jaundice. Seek immediate medical attention if you notice severe skin rash, unexplained bleeding, persistent fever, or yellowing of the skin/eyes. 8. Contraindications. Do not use syrup if you are allergic to sulfur drugs or permethamine, you have severe liver or kidney disease, you are a baby under 2 months old, you are in the first trimester of pregnancy, unless prescribed for specific preventive programs. No warnings. Precautions. Use with caution in patients with folate deficiency. Not recommended for frequent or use due to risk of resistance. Monitor patients with a history of severe allergies or skin disorders closely. Thus, drug interactions. Potentially dangerous interactions can occur with methotrexate, increases toxicity risk. Other folate antagonists, additive bone marrow suppression, or other sulfur drugs, increased hypersensitivity risk. Warfarin, possible enhanced anticoagulant effect. 11. Overdose management. Symptoms of overdose: severe nausea, vomiting, confusion, dizziness, bone marrow suppression leading to anemia or low white blood cells. Treatment: immediate medical attention. Activated charcoal if taken recently. Suppurative therapy including folinic acid, leucovorin, to counteract permethamine toxicity. 12. Storage handling. Stir below 25 degrees Celsius, room temperature. Protect from light and moisture. Keep out of reach of children. Do not use after expiry date printed on the bottle. 13. Cost availability. In Pakistan, syrup is widely available at pharmacies and hospitals. It is and prices vary, but a 15 ml bottle typically costs 50-80 depending on region. 14. Patient counseling tips. Always complete the dose as advised. Stopping early may cause treatment failure. If vomiting occurs within 30 minutes of taking the dose, retake it. Avoid alcohol during treatment to reduce liver stress. Watch for any allergic symptoms and report immediately. 15. Frequently asked questions, FAQs. Q. Can I take syrup on an empty stomach? A. Yes, but taking it with food may reduce nausea. Q. Is it safe for breastfeeding mothers? A. Small amounts may pass into breast milk. Consult a doctor. Q. Can syrup be used for prevention? A. Yes, but only in specific preventive programs and on professional guidance. Q. What should I do if I miss my dose? A. Take it as soon as you remember, unless it's almost time for the next scheduled dose, then skip it. 16. Conclusion.